rising interest in biological sciences, supernatural explanations were started to be discounted. Biological models attributed mental disorders to physical diseases and biochemical imbalances in the body. Explanation: as people learned more about the science of the human body, they started to realize that supernatural explanations for mental disorders weren't accurate. Instead, they began to believe that these disorders were caused by physical problems in the body, like diseases or imbalances in chemicals. This shift in thinking helped them understand mental disorders in a more scientific way.
जब लोग शरीर के विज्ञान के बारे में और जानने लगे, तब उन्हें पता चला कि असाधारण व्यवहार की सुपरनैचुरल व्याख्यान सही नहीं होती। इसके बजाय उन्होंने सोचा कि ये विकार शरीर में होने वाले रोग या रासायनिक असंतुलन की वजह से हो सकते हैं। इस बदलाव ने उन्हें मानसिक विकारों को वैज्ञानिक तरीके से समझने में मदद की।
1. 3. One early Greek contributions, Hippocrates and Galen. The Greek physician Hippocrates ridiculed demonological accounts of illness and insanity. Instead, Hippocrates hypothesized that abnormal behavior, like other forms of disease, had natural causes. Health depended on maintaining a natural balance within the body, specifically a balance of 4 body fluids, which were also known as the 4 humors: blood, black bile, and yellow bile. Hippocrates argued that various types of disorder or psychopathology resulted from either an excess or deficiency of one of these 4 fluids. The Hippocratic perspective dominated medical thought in Western countries until the middle of the 19th century. People trained in the Hippocratic tradition viewed disease as a unitary concept. In other words, physicians did not distinguish between mental disorders and other types of illness. All problems were considered to be the result of an imbalance of body fluids, and treatment procedures were designed in an attempt to restore the ideal balance. Galen, a Roman physician, adopted Hippocratic theory and advocated that the 4 fluids relate to the Greek environmental concepts such as heat, blood, dryness, black bile, moisture, yellow bile, and cold, phlegm. Each fluid was related to one quality. Excess of one or more fluids were treated by regulating the environment to increase or decrease heat, dryness, moisture, and cold depending on the deficiency of the fluid. For example, when King Charles VI got sick, he was treated according to the following concept of Galen. He was moved to less stressful countryside environment to restore the balance of his body fluids. Rest, good diet, and exercise were recommended. Explanation: long ago, a Greek doctor named Hippocrates thought that abnormal behavior and illness had natural causes, not supernatural ones. He believed that the body had 4 fluids called humors: blood, phlegm, black bile, and yellow bile. Hippocrates said that if these fluids were out of balance, it could cause different kinds of problems. Many people followed his ideas and believed that all diseases, including mental disorders, were caused by imbalances in these fluids. They used treatments like bloodletting, removing some blood from the body, and induced vomiting to try to restore the balance and make people feel better. Another Roman doctor named Galen also agreed with Hippocrates and added that the environment played a role in these imbalances. For example, if someone had too much heat in their body, they would be taken to a cooler place to help them get better.
बहुत पुराने समय में एक डॉक्टर था जिसका नाम हिप्पोक्रेट्स था। वे बताते थे कि जब हमारे शरीर में एक संतुलन होता है तब हम स्वस्थ रहते हैं। इस संतुलन को बनाए रखने के लिए शरीर में 4 तरल प्रवाह होते हैं: खून, कफ, काला पित्त और पीला पित्त। हिप्पोक्रेट्स ने कहा था कि जब इन तरलों में किसी एक की मात्रा ज़्यादा हो जाती है या कम हो जाती है तो हमें अलग अलग प्रकार की बीमारियां हो सकती हैं। ये बीमारियां बाहरी भागों की गर्मी, सुखापन, नमी और ठंड से जुड़ी हो सकती हैं। इस सोच के अनुसार राजा चार्ल्स छठे के बीमार होने पर उन्हें इस तरीके से उपचार दिया गया। उन्हें आराम, अच्छा खान पान और व्यायाम की सलाह दी गई। मानसिक रोगों के बारे में सोचने के लिए इन तरलों के संतुलन का महत्वपूर्ण रोल था। जब किसी व्यक्ति को भूत प्रेत जैसी बातें सुनाई देती थी, तो डॉक्टर यह समझते थे कि उनके शरीर में तरलों का संतुलन ठीक नहीं हो।
1. 3. 2 19th century J. P. Gray and E. Creepland J. P. Gray theorized that mental disorder insanity was always due to physical causes and emphasis should be on rest and diet, proper room temperature, and ventilation. He even invented the rotary fan and used it at State Hospital in New York. Emil Creepelin contributed in the area of diagnosis and classification of psychological disorders. Each psychological disorder had a different age of onset and time course to follow, along with a different cluster of presenting symptoms. His descriptions of schizophrenia are still useful. He described schizophrenia as a psychotic disorder having 11 subtypes where reality contact was severely lost with delusions, false beliefs, and hallucinations. Explanation J. B. Gray believed that mental disorders, insanity always had physical causes, and the focus should be on rest, proper diet, maintaining room temperature, and ensuring good ventilation. He even invented the rotary fan and used it at a state hospital in New York. Emil Creepelin made contributions in diagnosing and classifying psychological disorders. Each disorder had a specific age of onset and duration, along with a unique set of symptoms. His descriptions of schizophrenia are still helpful. He described schizophrenia as a type of mental disorder where a person loses touch with reality, experiencing delusions, false beliefs, and hallucinations.
J. P. ग्रे ने सोचा कि मानसिक रोग, पागलपन हमेशा शारीरिक कारणों के कारण होता है और उसका उपचार आराम, सही खान पान, ठीक कमरे का तापमान और स्वच्छ हवा पर ध्यान केंद्रित होना चाहिए। उन्होंने बाहरी हवा को ठंडा और खुश्क रखने के लिए रोटरी पंखा आविष्कार किया और इसे न्यूयॉर्क के एक अस्पताल में इस्तेमाल किया। एमिल क्रेपेलिन ने मानसिक रोगों के निदान और वर्गीकरण में योगदान दिया। उनके अनुसार हर मानसिक रोग की अपनी आरंभ, उम्र और समयांतर की एक खास श्रृंखला होती थी और उसके दिखाई देने वाले लक्षण भी अलग अलग होते थे। उन्होंने स्किज़ोफ्रेनिया को एक मानसिक विकार के रूप में वर्णित किया जिसमें व्यक्ति वास्तविकता से अलग हो जाता है और उन्हें गलत विश्वास और भ्रम का अनुभव होता है।
1. 3. 20th century insulin shock therapy and electroconvulsive therapy in 1000. 927 Manfred Sakel, a Viennese physician, began using higher and higher dosages. A brief history of psychopathology. Foundations of psychopathology. Adolf insulin. The patients had convulsions and went into a state of coma, but surprisingly these patients recovered, so physicians started to use it frequently. The method was abandoned because it was dangerous, caused coma, and even death. Joseph Meduna. In 1920 observed that schizophrenia was rarely found in epileptics, which later did not prove to be true, and his followers concluded that induced brain seizures might cure schizophrenia. Electroconvulsive therapy (ECT) was used extensively and frequently by doctors, but was a controversial method. Some doctors even used it to penalize the difficult, unmanageable patients. It is effective with suicidal patients. Explanation. In the past, there were two treatments used for mental disorders. One was insulin shock therapy, where patients were given high doses of insulin. This caused convulsions and put them into a coma. Surprisingly, some patients recovered, so doctors started using it more often. However, it was dangerous and could even cause coma or death, so it was eventually abandoned. The other treatment was electroconvulsive therapy (ECT). It involved using electric currents to induce seizures in the brain. Doctors used ECT a lot, but it was a controversial method. Some doctors even used it as a punishment for difficult patients. However, it was found to be effective for patients at risk of suicide.
पुराने समय में मानसिक रोगों के लिए 2 उपचार थे। पहला था इंसुलिन शॉक थेरेपी, जिसमें मरीजों को इंसुलिन की ज़्यादा मात्रा दी जाती थी। इससे उन्हें ऐंठन आती थी और वे कोमा में चले जाते थे, लेकिन कुछ मरीज इसके बाद ठीक हो जाते थे। यह उपचार खतरनाक था और बंद कर दिया गया। दूसरा थेरेपी था इलेक्ट्रोकन्वल्सिव थेरेपी (ECT), जिसमें मस्तिष्क में बिजली का उपयोग किया जाता था। यह उपचार विवादास्पद था। कुछ डॉक्टर तंग मरीजों के लिए इसे दंड के रूप में भी इस्तेमाल करते थे। इसका उपयोग सुसाइड करने के खतरे में पड़े मरीजों के लिए किया जाता था।